In total, there were 2 days of lectures. We heard about the prevalence of social cooperatives in Italy, how they have been set up to support the elderly, the disabled, the addicted and the deprived, and how they provide an alternative model of more local welfare, applicable to the whole of Europe and beyond. Valerio Pellerossi organised the workshop.
Globally, this is like the model for the law and the model for the entrepreneurial activity is Italy. We count hundreds or thousands of social cooperatives that are similar to the Italian model in Spain, France, where this model has been evolving.
Valerio's organisation has over 6,000 social cooperatives as members. But what exactly makes these organisations distinctive? Tommaso Sorichetti runs an organisation that supports cooperatives and helps them to grow.
Cooperation is work, but is always also care to person. And so for us as a cooperative, we are a movement, but we put our user, our customer, our beneficiary inside the process. And so this is the difference between profit and non-profit, because our revenue is always invested in our operations, in our actions, also co-planning and co-designing for the community, growing up with the network.
How do they actually work? Paola Ziliani runs a co-op called Learning Education Network, supporting teenagers and adults in the city of Parma. She explained how her co-op cooperated. There were 70 members, she said, who met once a year. 25 partners met twice a year, and then the core team.
We are 10 or 15 workers who work together every day, but 3 times in a month we meet and we say our situation, our work, our objective,
You share your stories?
Yeah, we share our work, our job, we share our difficulties, and we can call for help.
Okay. And the users, the beneficiaries, they don't have a say in the way...
No, in this situation, no. But we can call for the users, but not in this reunion. We can ask them how is going the service, the quality of the service, and then in this reunion we talk about this, but we are only us.
Several of the speakers explained that the definition of a social cooperative is not universal across the whole of Europe. There is no accepted standard as to who should be members, and neither is there an accepted procedure in evaluating the social gain of such organisations. Therefore, there was an awareness that we might not be talking about exactly the same thing. Robert Vicentena provided a British perspective.
I'm trying to understand the sort of legal status of cooperatives in Italy. I'm not sure I'm quite there yet. It seems there is difference between the UK, different models, different legislation. So need to understand that a bit more. But you know, the whole ethos of cooperating and for social goods and well-being is there.
As with all these events, much of the value was in actually meeting others who are doing the same sort of thing, exchanging stories and information over drinks and food. At the back of my mind was the thought of how do we start? How do we get things off the ground and why? Questions that I put to the principal speakers. Valerio first explained that the social cooperative revolution in Italy arose not just because of individual endeavour, but because needs were not being met by the state.
They felt the need of providing answers to certain needs and certain services that were not provided by the state or at local level, so they had simply organized themselves. So families with children with disabilities or those thinking in the period of the closing up of mental health clinics, I would say, manicomi in Italy, where during this period there was a revolution in the way we were approaching towards services and toward persons with difficulties, mental illness.
Given that the state is now trying to retreat from providing services all over Europe, it would appear to be a good time to start a few more co-ops. So how do we start?
But the first thing you have to do is to define better your idea, and the better way to define your idea is to involve and to engage other people could be interested in. And so define, the group, the idea, and then improve it and test it with the community. And so members of the community naturally will come in your organization, and then try this legal form and test your service and test your project.
How does all that fit in with what's happening here in Y? There is the retreat of the state from providing adequate services, certainly. There's disgruntlement among the users who want something better, and there are plenty of people who might be willing to help in some way. What's more unclear is exactly what service or services a social care co-op in this village would offer. How much power the local and health authorities might be willing to divest to workers who currently do the work. Would these workers even be interested in taking a more active role? Or are we talking about a co-op where we recruit a whole new batch of people from scratch? Those are things that will take a few cups of tea to sort out. So while the kettle boils, I thought I'd take a quick look round the village.